opinions. They do not necessarily represent the views of the advertisers, management, staff, or ownership of WCTC.
Speak up and be heard on Jersey issues that matter most to you. Call Jersey Central with Bert Barron now at 732-545-9282 or toll free at 888-545-9282. Your state, your home, your voice. Jersey Central with Bert Barron on the new Talk Radio 1450 WCTC.
It is 7:08. Welcome to hour number 2 of Jersey Central on the new Talk Radio 1450 WCTC, the voice of Central Jersey. It's Bert Barron. Good to have you inside with the Forge Jeweler Studios with us today. We'll do our contest in just a bit. Got your chance to win some tickets to the Golden Oldies Spectacular, returning to the State Theater on Saturday, November 12th. Bert's Backwards Oldie will be the game that we'll be playing today, and your chance to win is coming up. To the Jersey Central Newsmaker Hotline we go, and let's welcome in Dr. Henry Tsai, who was with us here this morning from ProCure Proton Therapy Center. As October is Breast Cancer Awareness Month, and we'll talk to Dr. Tsai about a pretty timely topic this morning. Dr. Tsai, it's Bert Barron. Good morning. How are you?
Good morning. How are you? I'm doing well. Thank you so much.
Sure. Good to talk to you. And first of all, thank you. I understand you're going to be appearing coming up at our Health and Wealth Forum this Saturday to talk about prostate and breast and pediatric cancers as well. So it's always great to have ProCure at the Health and Wealth Forum. So thank you guys for coming out this coming Saturday. Looking forward to it.
Absolutely. Absolutely. We're looking forward to it as well.
All right. October, Breast Cancer Awareness Month that is recognized nationally. And, I always wondered about the services offered at ProCure. Do you treat breast cancer there? I always wondered about that. And I was wondering what you're seeing in terms of incidence of breast cancer diagnosis, younger and older women here in the state of New Jersey, Dr. Tsai.
Absolutely. Well, Breast Cancer Awareness Month is great because not only are we talking about very important things like just, making women understand what the risk factors and screening tools there are for breast cancer, but also what treatment options there are. And in all domains, surgery, radiation, chemotherapy, many advances are being made. And proton therapy, which is what we do at ProCure, is just one of those advances that helps us treat breast cancer patients more effectively and more safely. We are treating breast cancer patients actively. We use proton therapy as a form of very targeted and precise radiation treatment. So that really enables us to deliver the radiation to the patient with as little in terms of collateral damage as possible.
What's the first thing that a woman, or in case of breast cancer, men get it too? What's the first thing that someone should do if they're diagnosed, Dr. Tsai, and how do you navigate through the treatment options?
Yeah, well, I think obviously a little bit of anxiety sets in, and it's important to turn to friends and family to get that social support. But then to meet with a doctor, meet with a breast surgeon or an oncologist to talk about what different strategies there are to address the breast cancer. And so it's so important to really turn to your medical providers and get the best advice possible.
And I was curious, and I'm glad you cleared that up too, about how the process that you do there at ProCure, how it's able to protect just everything around when you're treating breast cancer, how you're able to sort of protect everything else in the woman's body there with that precise and the precision technique that the proton therapy is. It really makes a tremendous difference, I'm guessing, in treating this. And much like any other cancer, Dr. Tsai, early detection is still a key weapon in this war, right?
Correct. And certainly the earlier we find the cancer, the earlier it is, the easier it is to treat it. And by using proton therapy, we find that, many of these women who are diagnosed and treated for breast cancer survive for a long, long time. And so it's important not just to cure the cancer, but also to make sure that they're suffering as few side effects as possible. And by using proton radiation, which, unlike regular X-rays, stops at a specific distance within the body, we're able to really get that radiation right to where it has to go and then have it stop. So whereas in the past, things like unnecessary radiation to the heart and lungs that are sitting right behind the breast was a serious problem, with proton therapy, we've been very pleased by how the beam stops and allows us to minimize the dose to the heart and lungs. And we're doing clinical trials to look at this, and we're offering this treatment to many stages of breast cancer. And so far, we've been very pleased with the results, and the feedback we've been getting from the patients has been outstanding.
Terrific. Dr. Henry Tsai is our guest this morning here on Jersey Central and the new Talk Radio WCTC. He, of course, of ProCure Proton Therapy Center. Dr. Tsai will be appearing this coming Saturday at our Health and Wealth Forum, so another incentive and another reason for you to sign up to attend the free event coming up this Saturday at the Pines Manor, beginning at 8:30 with breakfast. The program begins at 9. And Dr. Tsai will be among our terrific lineup of panelists and speakers who will be there on Saturday, so hopefully you'll be joining up. Dr. Tsai, can you walk us through what a patient can expect when they go for treatment at ProCure?
Sure. The first step is to walk into the lobby of our facility, which I welcome people to come by and just check out. We're a large Proton facility. We have a welcoming, warm, comforting lobby. You meet with our concierge who helps out with the logistics of, transportation and lodging if necessary. And then they meet with our physicians who are trained in proton therapy and evaluate the patient as a whole to look at all the aspects of their care and decide, is proton therapy right? Is this really the best treatment option for me in terms of radiation? And if so, we go through a process of mapping out the treatments, which is customized to each patient. And then once patients start treatment, it is a daily treatment, just like regular radiation. The patient lays on the treatment table, the beam is delivered in a specific way, and the whole process takes maybe 30 or 40 minutes a day. And this goes on Monday through Friday, 5 days a week, typically for about 5.5 or 6 weeks. So the treatments are very gentle. It's like getting an X-ray, but we know that the side effects can be very gradual if they happen. And so most women tolerate it very well and get through the whole course and continue to do what they enjoy doing, whether it's work or family activities. It doesn't really impede your ability to do your normal activities. And then after we're done with treatments, we do a graduation ceremony and celebrate the fact that patients finish treatment and then continue on with their follow-up care.
That's terrific. And it just sounds to me that it's just nowhere near as taxing on the body, Dr. Tsai, as some of these other traditional treatments, chemotherapy and whatnot. It doesn't sound like it's as tough on the body to endure something like this.
Well, yes, and it's important to realize that proton therapy is not a substitute for surgery or radiation. It's a substitute for surgery or chemotherapy, but it does provide a very gentle treatment that most women find very tolerable compared to the other aspects of the treatment.
All right, good stuff. Dr. Tsai, it's always good to talk to you here on WCTC, and thank you again for being a part of our Health Food and Wealth Forum coming up on Saturday, and you're doing amazing work there, and I'm glad that we were able to get you on this morning to talk about Breast Cancer Awareness Month, all right?
Thank you. It was my pleasure.
All right, thank you. All right, Dr. Tsai, my guest here on WCTC.